Over the more than 25 years that I've had the disease, there's now much research and doctors are much more aware. And there are some differences between those for whom the disease came on slowly and those like myself where there was a sudden onset. The Chronic Fatigue Immune Dysfunction Association now does a lot of work and research to help doctors and patients as well. They talk about it this way. Although its name trivializes the illness as little more than mere tiredness, chronic fatigue and immune dysfunction syndrome begins with a constellation of debilitating symptoms. It's characterized by incapacitating fatigue, experienced as profound exhaustion and extremely poor stamina, sometimes problem with concentration, and it's accompanied by flu-like symptoms, sometimes pain. I've not had that. A distinctive characteristic is the malaise that comes after exertion. We're supposed to do exercise, but if you go over, you may be sick for a few days or a few weeks. The symptoms are invisible, which make it difficult for others to understand this vast array. Sometimes people report difficulty finding words, inability to comprehend or retain various information, depression, anxiety. The whole list goes on here. Some people have sensitivity to noise or bright light or to chemicals or to medications. There can be lightheadedness, muscle spasms, neurological symptoms, and also seizures. It's helpful now that we have this information, but still there's no known cause and no cure, just a way for doctors to help patients live with it. Those first 12 years, as I gradually got better, seemed to be less troubling, but now in retrospect I can see that there were episodes, often in an evening, when I would simply just go over my limit a little bit. Most people can just take a good night's sleep or eat a little food and recover, but the weakness would come to me and then it would be days or sometimes weeks before I could recover. I remember one time teaching at Princeton University in the summer, and we were teaching and doing other things, and then I hit this fall through the floor fatigue, and Burton had to come through and help me teach my session the next day. But simply, as you can see, I just went on. Life goes on. I wasn't going to give in to